Hello everyone, this is Dr.Akshata Shanbhag. Today we will learn the comparative study of Calcarea carbonicum. First we will see the sphere of action of this drug. So as we know, it has mainly action in the impaired nutrition and digestion, which leads to slowness in teething and walking. It acts on glands where it causes swelling, enlargement, etc. So any glands can be affected, mainly thyroid, pituitary and sweat glands, where it causes increased local or general perspiration is seen. Then it has action definitely on the bones, where there are deformed development leading it to the rachitic type of development, and there is it acts even as a stimulant to the periosteum. And it has action on the blood as a hemostatic effect. It raises the blood coagulability, so it can be used in hemorrhagic conditions. It acts on mucous membrane, where it causes increased mucus secretion. So constitutionally you can see that there is leucophlegmatic constitution in Calcarea carb, means they have fair, fat, flabby, chalky look, pale skin, large bellied, large head with open fontanelles in infants. And scrofulous constitution, where there are fat children, rather bloated than solid, pale but flushing easily, and the glands will be enlarged. So you find glandular enlargement anywhere in the body. Now we will come to the comparison of this drug. So the main comparison you need to understand is Calcarea carb and sulfur. So we know that sulfur is a lean, stoop-shouldered person, while Calcarea carb, as we studied, fair, fat, flabby kind of person will be present. Then in action you will find the sulfur is very quick, wiry, nervous, activeness you find more in the sulfur, while exactly opposite you see in Calcarea carb, where they are very sluggish or slow in its movement. And main other difference is, in sulfur burning sensation is present in general, anywhere in the body, any complaint they will have burning prominently, while Calcarea carb has coldness in general. Then there is offensive odor of the body present in the sulfur, while Calcarea carb has sour smell of the whole body. Then sulfur has diarrhea aggravation in the morning, while Calcarea carb diarrhea aggravation in the afternoon is seen mainly. Sulfur is not better when constipated, while Calcarea carb generally is better when constipated. And sulfur acts on upper portion of the left lung, while Calcarea carb acts on the middle and upper portion of the right lung. So, and both the drugs are having one symptom, that is least mental excitement causes profuse return of the menstrual flow. Same thing you find in Calcarea carb as well as in the sulfur. So they are very sensitive mentally. Aggravation from least mental excitement can increase the menstrual flow. So both have amelioration from cold. Then we will see the difference between Calcarea carb, sulfur, artemisia and nux vomica in epilepsy. So we know that artemisia, nux vomica, we use it even in the epileptic conditions. So how you can differentiate those drugs? So in sulfur you find epilepsy from suppression of some chronic eruptions and excess in venery, etc. So you find Calcarea carb also same, but also aggravation from the fright. So they have ailment, epileptic condition may occur after fright. So artemisia has ailments from fright only, while nux vomica you will find ailments mainly from indigestion. Ailments is the causation you can take. After indigestion they may suffer with the epileptic condition. So and the aura also is compared here. So in sulfur you will find sulfur and Calcarea carb have same aura, which begins in the solar plexus and moves upwards and has convulsions. So solar plexus is the stomach area, where the sensation will start, where the aura begins, and it moves upwards, and then the epileptic attack starts. So same thing you find in the Calcarea carp. Artemisia, the attacks are duplicated, and in Nux vomica the aura begins in the epigastrium and spreads upwards. So here you can compare with the Bufo and Cilicia also. So in the sulfur, they feel as if a mouse were running up the arm. Same thing you find in the Calcarea carb. So both these will have this sensation of mouse running up the arm. Then Calcarea carb and phosphorus both have swelling of glands and indolent ulcerations. So indolent ulceration is which are not healed easily, which are very stubborn ulcers. So then we call it as indolent ulcers. Then they both have difficulty in learning to talk and walk. And the difference you find here is Calcarea carb, the patient is fair, fat, flabby, abdomen is enlarged like an inverted saucer, pale lips, pale skin. While phosphorus, patient has delicate, refined skin, features are sharp and handsome, eyelashes are long and silky, their hair is dark and glossy. So you will find the phosphorus to be very tall, thin, lean. Okay, so while Calcarea carb are more fatty side. Then Calcarea carb and nitric acid have corneal ulcers. So difference is, if it is a nitric acid, corneal ulcers will progress and threaten to perforate or destroy the whole cornea itself. So this is the initial stage in the Calcarea carb ulceration, while if it reaches to the perforation stage, then nitric acid should be thought. Then Calcarea carb, Ethusa, Antim crude and creosote. So Calcarea carb we see after nursing, milk is vomited in white or yellowish or greenish curds. Vomiting exhausts and the child goes to sleep. Same thing happens even in the Ethusa, but he wants to nurse again. So Ethusa is having a cycle where they will be having the milk, they will vomit it, they will go to sleep, and again when they wake up, again they want the milk, again they will vomit, again they will go to sleep. So there the cycle continues in the Ethusa, but that is not there in the Calcarea carb. Antim crude, after nursing, the child vomits its milk in little white curds but refuses to nurse afterwards, same as the Calcarea carb. Creosote, the stomach is so weak that it cannot retain or digest the food, so that the food is vomited either immediately or hours after eating. Then Calcarea carb and colophyllum, we have leukorrhea comparison. So Calcarea carb leukorrhea occurs before puberty, even in infants it is seen, the white discharge. While colophyllum, leukorrhea of little girls is seen when the discharge is profuse and weakens the child very much. So both the drugs are having leukorrhea in the younger age group, like little girls before puberty and all. So here weakness will be marked after the leukorrhea in the colophyllum. Then coming to the Calcarea carb, Mesothelium, lithium carb and cicuta. So in Calcarea carb we find chronic urticaria and herpes on the parts of the face covered by whiskers. So that is where the rashes, the beard will be there, mustache will be there. So especially the beard in the males. So there you will find more of herpetic eruptions, urticarial rashes and all in the Calcarea carb. So Mesothelium, there is itching in the whiskers as from vermin or scaliness. So vermin in the sense as if some worms are crawling. So it leads to itching, and there will be scaliness present. So white powderish scaliness will be seen. Lithium carb, the cheeks under the whiskers is rough, as a greater itching will be present. And then there is cicuta, where there is thick honey colored scabs are seen in the whiskers as well as about the corners of the mouth. Then Calcarea carb, Rustox, Calcarea floor, sickle core, and Nux vomica. So rheumatism, if we compare, especially of the backache. So Calcarea carb, rheumatism of back muscles and shoulders after working in the water you will find. Gouty nodosities will be seen about the fingers, and they have constitutional gout, and in arthritis deformance it can be thought. Calcarea carb. So Rustox, lumbago will be present. The pains are ameliorated from motion or not. So there is special affinity for the deep muscles of the back also in the Rustox. So we know the modality mainly in the Rustox that we can compare. So while Calcarea floor, there is lumbago aggravation on beginning to move but ameliorated on continuous motion. So same thing you find even in the Rustox also, same thing is seen. So then comes the sickle core, where sudden catch or kink is present in the back. Nux vomica, rheumatism of the back is seen when the patient is unable to turn. He must sit up in order to turn in the bed. So then nux vomica we need to think. If the patient complains that he cannot turn in bed easily, he has to sit and then he has to turn to one side and then go to sleep. So then nux vomica will come there. So these are the comparisons I have got in the E.A. Farrington Clinical Materia Medica, E.B. Nash, Leaders in Homeopathic Therapeutics with Grouping and Classification, W. Borick, Pocket Manual of Homeopathic Materia Medica and Repertory, Clark Dictionary of Practical Materia Medica, J.T. Kent Lectures on Homeopathic Materia Medica. So there may be many other comparisons also in the Calcarea carb. So individually when we study the drugs, we can compare it easily with few more symptoms in the comparison. So that we will do it in the other videos and all, future videos. Thank you.